There are two forms of dental x-rays. One is what we call an intraoral dental x-ray, and the other one is what we call an extraoral dental x-ray. An intraoral x-ray, we use a sensor, place it on the inside of the teeth, then we have an x-ray machine positioned on the outside, and then we take an x-ray of those teeth, and then we are able to see those x-rays on the computer screen. Previously, there was what we call the manual x-rays, where we use dental films, and then you had to expose those films, take them to a dark room, develop them, and then from there you are able to see the x-ray. There are still many offices which are still using that. But at Tender Care, we've moved away from that. We are now using digital x-rays. Why digital? Because there is less radiation, and therefore you can take more x-rays. You are able to see the picture or the x-ray very clearly on a computer screen, and you're able to store that on a long term. The ones which were manual on the film, they degrade with time, and therefore you can't refer to them a year, 2 years. But now we can be able to see with the digital x-rays, we're able to see that. The second x-ray I mentioned is the most common one that we take at Tender Care, an OPG, or a panoramic x-ray. The machine goes around your head and takes an x-ray of all your teeth, all the jaws, the sinuses, and that kind of thing. So that one, we are able to see a panoramic view. We are able to make diagnostic information. If they are impacted teeth, we are able to see that. The level of the bone for the whole jaw, we are able to see that in one x-ray. We call it a baseline x-ray that we actually take for almost all our patients when they come. So we are able to see the work which has been done before, defective work, and all that kind of thing. Later on, we may want to take a localized x-ray, the intraoral one, especially when we are doing root canals. When we want to find out are there cavities in between the teeth, then we go for the intraoral x-ray. I will be going to another part of the clinic, and I will be able to demonstrate and show you how does an intraoral x-ray work and how does a panoramic x-ray work. There is one third x-ray I would mention called a CBCT, a 3D x-ray. That is very, very new in the market. That is a recent addition in the market. That particular machine, we don't have it in our office, but we hope to get it in the near future. So that one is for specific treatments, things like implants, or when you want to remove a third molar that is very close to the nerves and you want to see how the nerve is going. That one, we want to see an exact 3D of how the tissues and everything look like before we can go in and do an operation on you. Thank you very much.